Ebola, measles, whooping cough, deadly superbugs. Oh my. America's now flirting with 19th century diseases that had once been wiped out. Flash forward to today, and these infectious diseases are claiming lives from coast to coast, bringing back heartbreak to families all over the nation. The worst part, most of these outbreaks could have easily been prevented. Hi, I'm John Phillips. Thanks so much for joining us for this PJTV special, Pandemic Panic, How to Survive the Deadly Outbreaks, in other words that start with P. The series will provide you with life-saving advice on how to avoid becoming infected. Most of you have been vaccinated, of course, which is key to avoid falling ill. We'll talk about the anti-vaccination movement and how that's putting you and your family, particularly young children, at risk. Also, learn the steps that you can take to help stopping the spread of deadly outbreaks. But first, let's go ahead and meet the panel. Let's begin with PJTV contributor from his home studio in the great state of Texas, one Mr. Scott Ott. Joining me in Los Angeles is comic and PJTV contributor Stephen Kruiser. Also here is medical doctor extraordinaire, trauma surgeon, and expert on disaster situations, Dr. Kelly Victory. I think this is your first time on PJTV, so welcome.
It is, thank you.
Let's go ahead and discuss the rise of infectious diseases we've experienced here in 2014 and 2015. West Africa has been a hotbed for the Ebola virus. People traveled to the infected region and came back to the United States with the disease. That, of course, sparked a major scare as the Centers for Disease Control couldn't determine the initial source of the outbreak. Nurses and doctors were forced into quarantine until they were deemed to be safe and not infected. Let's go ahead and get into this outbreak. Dr. Victory, should I be hesitant to travel to any country where the president of that country is wearing sunglasses in his official portrait?
Well, I will tell you that the issue with Ebola is not that Ebola has necessarily increased worldwide, but that it has moved out of the areas where it has remained contained over to the United States. Ebola was first reported by the World Health Organization in 1976, and it has been contained in largely sub-Saharan Africa, Liberia and Guinea, since that time, until last year, when quite a number of healthcare workers made the decision to go over to do humanitarian work over there, and then came back having been exposed to the virus and having contracted it and brought it for the first time in history to the United States. Well, I think the issue is people have a right, absolutely, and I respect the right of any healthcare worker to go into any part of the world to do humanitarian work. But with that right, I believe, comes the obligation to then protect those people who are going to come in contact with you upon your return. And so the only reasonable way to have managed this from the beginning was by strict quarantine. This is sort of epidemiology 101. We know that when you are exposed to or potentially exposed to something that has the rate of morbidity and mortality that Ebola does, extraordinarily high, kills upwards of 50% of all the people who contract it, then there are two ways to manage that. Number one is to quarantine anybody who is potentially exposed. And the second thing is to close the door. I like believe,
door number two.
Yes, I firmly believe that the flights from sub-Saharan Africa should have been cut off as soon as it started to happen.
Nina Pham, who is the nurse who was exposed to Ebola and quarantined in Texas, is now suing the hospital, saying they should have been prepared for something like this. My colleague at 790 KABC, Dr. Drew Pinsky, said if hospitals are expected to have that level of caution, then expect your health care bill to quadruple.
I absolutely agree. And part and parcel with going into healthcare is the fact that you are going to be at some risk for exposure to certain things. I believe the hospital did everything they could to get up to speed as quickly as possible. This was a brand new thing. Nobody was entirely sure how it should be managed and how the quarantine should happen, how the precautions for barrier protection should be handled within the hospital. So I think it's patently absurd for Nina Pham to be suing. They were not blatantly negligent. The hospital provided the gowns, they provided the training, and Nina Pham signed up to be to be a healthcare worker on the front lines, just as I did. And there were times when, for example, HIV had first come onto the fore, that people were being exposed to it unwittingly in the operating room and trauma centers, and just because of their exposure to bodily fluids. And so this, unfortunately, I think that Nina Pham was in the wrong place, but I don't feel that the hospital is culpable.
If Stephen Kruiser were king, would you cut off travel to these countries, or at least the return trips?
Oh, immediately. Part of a strict quarantine is not letting anybody go from the original place of the problem. that's you don't just quarantine them after they get back here. And anecdotally, we've mentioned this before, two very popular games in the last 2 years, Pandemic and Plague Inc. Both, what you're trying to do, you're trying to be the virus that's spreading in those games, and the quickest way to lose the game is to have one of the countries shut off travel. That's the way. That I learned just from playing video games, John. But yeah, you can't let somebody start going, because you lose track of them. You don't know who's traveling where, and it gets to be a problem in a hurry, because people, if it's just this guy here, we know, but when it's such a long incubation period, you don't know who's been where in the time while it was incubating and before any symptoms manifested themselves.
Scott, when you watch the old science fiction movies, one of the recurring themes that you see is time travel. They're obsessed with time travel, going way back into time, going into the future, whatever. It's a fun way to do a science fiction movie. But we really do have devices that allow time travel here on Earth. They're called airplanes. Is this just the new reality with world travel and airplanes and how easy it is to get from point A to point B? Is this a new reality, a new normal?
I think that's part of it. Obviously, people who before would have lived and died their entire lives in a 5-mile radius of their homes are now able to go all the way around the globe and carry with them whatever they're bearing on their bodies. But I think, frankly, a lot of it has to do with the Western proclivity to treat essentially Aboriginal or primitive groups of people as if their traditions deserve our respect. And one of the issues, or several of the issues that we have in Africa, are groups of people who have death rituals around the burial of somebody who's died that involve pouring water over them and then letting that water come into contact with other people who are living. And so they're literally, sort of drinking in the contagion. They also do ungodly things with monkeys that should not be done. And I think somebody needs to stand up and say, look, this is no longer appropriate. You want to do these things, you can go live in the desert in a compound and never leave there. But if you ever want to get outside of your village, you're not doing this anymore.
Well, it's not just Ebola. Whooping cough cases hit a record high in the United States in 2014. California, in particular, was hit hard by the epidemic as 800 cases were reported in a 2-week period. The respiratory infection was easily spread through coughing and sneezing. Most of the cases were infants and young children. A vaccination is key to controlling whooping cough. Let's go ahead and get into this outbreak. Kruiser, you got a daughter. Is this a vaccine that you made sure your daughter received from your medical professional?
Without question, yes, when she was younger. It was, it's weird. I've always been a fairly healthy guy. I never really got sick until my daughter went to school and started being around it's a little germ factory at school. The little kids are sneezing. Yep. There are no cleanliness protocols for a 6-year-old, okay? They're messy little beings, and there's goo, and there's sneezing, and there's everything. And then she started trekking home every little thing you could then, and those were just cold things. So when you worry about the more serious stuff, yes, definitely you have to protect them from whatever else is going on in that little petri dish of yuck known as a classroom.
What's the best way of avoiding something like this? Because you see these numbers and they're eye-pop. 800 cases in California.
Right. Well,
that's shocking.
It's truly a crime because whooping cough is a disease that we had significantly decreased in this country. After the introduction of the pertussis vaccination, whooping cough is caused by a bacteria called pertussis. After the introduction of the vaccine in 1940, we saw a significant decrease in the cases of whooping cough in this country until about 1982. And then there started to become this slow uptick, which has now increased significantly, largely because of the failure of parents to get their kids vaccinated, because it is a preventable illness. The vaccine is extraordinarily effective, but people aren't getting their kids vaccinated. Now they're treating it as optional.
Scott, I work at AM Talk Radio, so I have to broach this subject, but can this whooping cough epidemic be blamed on illegal aliens? We're in the Southwest here in California. 800 cases have been seen here in the Golden State. We had a flood of people come from the South, from Central America, not just Mexico, where they hadn't received their vaccinations in many cases. We didn't know who was coming in here. They were living in these facilities where they're essentially right on top of one another. And now all of a sudden we see a huge spike in these numbers. Is this something that we can blame on that?
Well, you know, obviously, I'm not a doctor, and I don't even play one on TV, and Dr. Victory's going to smack me down if I say anything that's scientifically incorrect here. But I do think that you've got to deal with the reality of the way life is right now. In dense population centers, as Kruiser referenced, when you have public schools, many of which have grown to hundreds, and in high schools, thousands of students, with hospitals getting bigger and bigger, and those concentrated groups of sick people gathering together, with more parents having their children in daycare situations before work than ever before. We have a lot of migration from one place to another. It's very easy for, just as it's easy for us to fly from country to country, it's easy for a disease to travel from country to country. And I do think that we should be serious about invoking health protocols at our borders that we would with our own citizens. Listen, I was raised by my grandfather. My grandfather in the 1920s contracted whooping cough. It almost killed him. He said he literally was holding onto his bed. He was coughing so hard. He was trying to hold onto his bed to keep from being thrown onto the floor. It delayed his entry into school by 6 months, and his mother was just glad he was alive. This is serious stuff, and anybody who doesn't treat it seriously needs to have their head examined.
You know, Kelly, when people used to come through LSI, they'd test them. They had doctors there. And if you had tuberculosis, they sent you back to Ireland.
Right.
Now we have all these people coming over here. We don't know who they are. We don't know what vaccines they've received. We don't know what their health status is. Do you think that's a big problem?
Well, I think it's a huge problem, but it all comes back. It comes back to the vaccination programs. And the more people that we're allowing in over the border who aren't vaccinated, who are potentially exposed and coming in here without, increases the number of people that we need to make sure are vaccinated here. It's the concept of herd immunity. Herd immunity only works, and herd immunity is the idea that even somebody who's not immunized, you might not be personally protected, but you infer protection because those around you are immune. But you have to have upwards of 96, 97% of the population actually immunized to make sure that when those other folks come in who aren't immunized, we don't have the spread of disease. So I think it's an enormous problem to have big populations of non-immunized folks coming into this country who are spreading the illness because they're decreasing the overall population of immunized folks.
Moving on to another blast from the past. In late 2014, a measles outbreak started at the happiest place on earth, Disneyland, right here in Anaheim, California. More than 100 people in 8 states have now become infected. Cases spread fast and furiously. In fact, January of 2015 saw more measles cases than all of 2012 combined. It's a hard pill to swallow, especially when there's a vaccine that could have easily prevented the outbreak from growing into a major health threat. It's believed a Disney visitor had the measles, as it is similar to a strain that's circulating in the Philippines. When you have an amusement park like this, and people, if you've been there recently, you know the lines are long and they seem to get longer every time you go. People are right on top of you. It's easy to spread these things like wildfire, isn't it?
Absolutely. But this comes down to, this is truly tragic because measles is a disease that had been largely eradicated in the United States. In fact, in 2000, the CDC determined that it was eliminated, which doesn't mean that it's extinct, but that it's no longer constantly present within the country, which means by definition, it has been brought in from outside of the country. But the vaccinations were extraordinarily effective. And so we are seeing this increase in this outbreak right now absolutely as a result of the fact that people are not having their kids vaccinated. And measles is a very serious illness. Many people have complications from it, not all life-threatening complications, but people spend significant time in the hospital. Nearly 50% of kids who get measles end up being hospitalized, and it can cause a lot of long-term effects, swelling of the brain, pneumonia, lots of other problems with it. But again, this was a disease that would not have been around, and we have taken what was a public health victory and turned it into a defeat by lack of vaccinations.
You know, Kruiser, you have many small L libertarian beliefs, as do I. And part of that philosophy is, as long as you're not doing anything that's hurting me, go ahead and do what you want to do. But if you decide, as part of your personal freedom, to not get your kid vaccinated against the measles, a disease, as she mentioned, was eradicated, and then your kid gets the disease because this fool decided not to take medical advice from people who are trained in this sort of thing, then they are hurting other people. Is there a role for the government to step in and require these vaccinations?
You know, this is one we've struggled with a lot since all of this started, but I think, yes, I think once you start affecting the general population, once you start doing something that can harm other people, and measles, the unvaccinated out there are babies, okay? That's harming very young children right there and putting them at risk, and people do bring babies out in public all the time. What are you're supposed to, if a person's, before their kid can get vaccinated, are people supposed to stay home for 14 months before they go anywhere? No, that's somebody trying to impose their little personal belief system on a large population, which gets really out of hand in a place like an amusement park where people are coming from all over the place, then going all over the place and infecting. Then you find out it really is a small world after all, John.
Scott, give me another parent's take on this.
Well, you know, these folks are just, the anti-vax crowd is taking advantage of what Dr. Victory was talking about, this herd immunity concept. They are surfing on our herd immunity, and they're assuming that they're going to be among the elite, the really thoughtful ones, the ones who have done their research on the internet, who won't be affected, and so they're not going to cause any problems for anybody. It's just not true. And what I was thinking as you guys were talking right now is the anti-vaccination crowd, anybody of those who happen to wander into this room and see this show will be saying, oh, yeah, there's some more of those corporate shills that are pushing the vaccination story that we all know causes autism and various other kinds of diseases. It's just nonsense. It's non-scientific. And I don't know who to blame for this. I mean, the government, at the one hand, is telling us we ought to be vaccinated. On the other hand, somehow these folks have escaped at least 12 years of public schooling and still having not enough science in their head to understand the fact that if your kid has the measles, do you realize that over the last 10, 15, 20 years, the average number of measles cases in the United States was in the neighborhood of 50, and last year it was 644? And also, go back to your high school math and learn a little bit about exponential growth, if you will.
Well, let's bring this back to home, because 14 infants at a daycare center in Santa Monica, California were quarantined over the measles outbreak. A child there contracted the disease because they were too young to be vaccinated. Children there range in age from 6 weeks to 3 years old. Kruiser, your daughter goes to school in this area, in the coastal Los Angeles area, not far from here. How did you react when you saw this on the news?
She goes to the school where that happened.
Okay, well,
that was at the faculty daycare center at Santa Monica High School. So it was. She was like freaked out about it because she had some. You know, everybody was gone for 3 weeks. Then there were teachers that couldn't bring their kids. There was like this affected a lot of people. They had to shift on the fly, figure out what to do because they had to shut the thing down for 3 weeks. She was worried. There was a teacher she really liked who had an infant. She didn't know if she was going to be at school anymore. And then of course her mother and I are like, she is up to date on the vaccines, right? Everything's we checked on that right away too. But it was like the kids. There was this distress within the student population too, even though they were high schoolers, because they were like, okay, now it's hit close to home. Before that, you know, it's just this thing you're talking. Oh, it happened at Disneyland. You know, it happened. Well, I haven't been to Disneyland this year. I don't worry about it now. Boom, it's at my school.
What advice would you give parents of a newborn, someone who hasn't been vaccinated yet, but the parents do want to eventually vaccinate the kid? If they live in an area where the vaccination rates are very low, like Santa Monica, California, would you tell them not to take their kid and put them in a daycare facility at a place like Santa Monica High School?
I'll tell you, I'd be hard-pressed to tell them that I felt safe with it when we're seeing these low rates of vaccination amongst other kids. Now, there is a bill being presented here in California to talk about actually requiring daycare workers and school teachers to be vaccinated, and I think that is likely the way that we're going to need to go. You realize there are only 2 states in the entire country that don't allow parents to opt out. We allow parents to opt out all the time. So although we want to say that it's just sort of in these little pockets in California or places where people are more liberal, it's really not the case. Only Mississippi and West Virginia don't allow parents the opportunity to opt out by personal preference for vaccinations. So this is really a problem, and I do think if you have a young child who's too young to be vaccinated themselves, that I would be limiting their exposure to a bunch of other non-vaccinated kids.
Yet if the children want to play sports, then they have to have vaccinations and things like that. So if there are things that a kid wants to do, then they're required to have vaccinations, but just not to be in the general population of the school, which is kind of insane.
Right.
Kruiser, or excuse me, Scott Hott, if you were the parent of this infant, how upset would you be?
Oh, furious. I mean, it's unbelievable that somebody could be so irresponsible with the life of my child. I mean, like I said, I'm not going to try to force my ways upon you. I'm libertarian enough to say you can do whatever you want, but go live in an anti-vax colony or wear a badge. I think we should make you wear a badge in public, a great big thing, and your kid should have this giant badge that says, I have not been vaccinated, or ring a bell as they walk through the streets shouting out unclean. If you want to do any of those things, that's fine.
Well, I think they have those shirts already made. They're called I'm with stupid, and then the arrow.
See,
Another big concern is the rise of superbugs, one that can't be treated with antibiotics. Those are very super. This all happened at UCLA Medical Center. Patients there were exposed to a contaminated piece of equipment, a medical scope. The superbug is highly resistant to antibiotics and can kill up to 50% of infected patients. That's huge. The scope has been linked to 2 deaths at UCLA after it spread the superbug to patients. Lawsuits have been filed against the maker of the scope because its design may impede effective cleaning. Who is to blame for this, Dr. Victory?
Well, there are 2 significant issues in this particular case. Number 1 is the development of another antibiotic-resistant pathogen out there. Okay, we've had people know about MRSA, which is resistant to certain antibiotics. This is a bug that is found in gut flora, in bacteria that's in the intestines, and so we have an antibiotic-resistant bacterium, which is already very concerning. The more concerning piece of this is that people were infected because there was transmission of that bacteria from one patient to the other because of a piece of equipment that wasn't properly sterilized. So there are 2 issues at play here.
And this is one of the top hospitals in the country.
Yes, and the particular instrument, this was what's called a duodenoscope. It was made by Olympus. It is made by Olympus. It's been out since 2010. It's a flexible scope that we use to go down the throat, through the stomach, to look at the first part of the intestine, generally to look at the gallbladder and how the duct system connects the gallbladder to the intestines. So somehow that scope was not cleaned in a way such that all the bacteria were eradicated from it. And I can understand how it happened. It's very easy if you have surgical instruments, for example, that are all made of metal, scalpel handles, retractors, forceps, things like that, scissors. They're very easy to plunk in a pan and put into an autoclave, which is essentially a big oven, and we crank the temperature up to 1,000 degrees and it kills everything. But these scopes are flexible. They have lots of moving parts. They have pieces that are rubber, pieces that are plastic, and more importantly, lots of nooks and crannies that don't allow you to actually adequately get all the bacteria cleaned out. And they're going to need to address that. So the scope has been out since 2010. It's my understanding that the FDA has been aware of this issue and did not want to remove the scopes from the market because the study that they are used for is relatively common, and they were afraid that there would not be enough scopes out there to get these procedures done. So we are now seeing the impact of it because it's undoubtedly happened before that bacteria has been transmitted from one patient to the other, but it never came to light because it wasn't an antibiotic-resistant bacteria. So now it's a problem.
Kruiser, is this Christmas morning for trial attorneys?
Oh my God! I mean, when you would think in the 21st century, when you go to a hospital, a vaunted medical facility like the UCLA Medical Center, you have a reasonable expectation that they're not going to pass some new 3-headed mutant superbug onto your colon. Okay, right. You would like to think that that's the bare minimum you can expect there. But then, you know, as Dr. Victory pointed out, the federal government got involved. Right. And when they help, you know, go back to Ronald Reagan's, at the Ronald Reagan Medical Center, no less, Ronald Reagan's words about the government helping. It's a nightmare, and this will be, every time you want to get the litigious nature of society toned down a little bit, then something happens that makes you go, okay, well, let's sue. So yes, this is a nightmare, and people should be able to expect to not have something like this happen.
Well, and here's the other thing that's going to happen, and maybe Scott Ott, you can weigh in on this, because people go to the doctor all the time, and the doctor says, I want to check something out. Let's take a preventative look at what's going on inside you. We just want to stick a scope in you and just look around and see what's there. If people are seeing these stories, they're going to say, you know what, I'll take a pass because I'm not going to risk getting one of these horrible diseases just from something that is totally preventable by saying no to the doctor. Your thoughts?
Well, yeah, and I have a little hesitancy about my own approach to this topic, because I have to acknowledge I don't know what the statistics are as far as percentages of people who have, deleterious outcomes as a result of the use of this scope, and how many people who maybe have their lives saved or their disease halted. And so, we need to take those things in context. And unfortunately, the general public doesn't read the medical journals and has no idea what the success rates are of these things and what the threat rates are of these things. And so I think you just need to educate yourself when you get in those situations. And you don't want to blindly say, no, don't stick that scope in me. But you do want to fully understand what the risks are. It's the part at the end of every, pharmaceutical commercial where they spend, more time than the commercial took to rattle off all the risks, including that you may have an erection lasting up to 4 hours and have strange dreams.
I have a hard time believing that in this day and age, as technologically advanced as we are, we can't find a way to properly clean medical equipment. I mean, get DARPA on that, okay? They'll figure it out in 45 minutes. I'm sure we have the financial resources. Yes.
My thought truly with the scope, because I think they're going to have to come up with some sort of a thing to put over it. I think the issue is to put a plastic condom of sorts over the entire thing that is then disposable, because you want the thing that's on the outside of the scope to be disposable. I mean, that's how we do it in the dentist's office. Most things either get autoclaved or you throw them away. And so I think that's really where this has to go. They have to come up with a better sleeve to put over the scope.
Dr. Kelly says use protection.
That's right.
There you go. Well, these outbreaks are far from over here in the United States. In this segment, we told you what to watch out for. Coming up in part 2 of our series, we'll talk about the group that's making these outbreaks even worse, anti-vaxxers. That, plus how you can prevent becoming the next statistics, is coming up in this special series. For the entire PJTV panel, I'm John Phillips. Thanks so much for watching.